Welcome to Suchok Medical. So in this video we will talk about medical negligence. So what is medical negligence? First of all we have to understand it. A breach of duty of a care by a medical professional resulting in harm or injury to the patient which would not have occurred if proper care had been taken. So this is the definition of medical negligence. Now break down the key word of this definition. So there is a word breach of duty. So breach of duty means the doctor failed to provide the standard care expected. Now the other word is standard of care. What it means by standard of care? The level of care reasonably competent doctor would provide in similar circumstances, and resulting harm means the patient must suffer physical, mental or financial damage due to the breach, and causation means the harm must be directly caused by negligence. So these are the key terms. And the legal, if we see the legal context of Indian, then it's covered under tort law, civil negligence, Indian Penal Code, IPC 304A, 337 and 338, and Consumer Protection Act, CPA 2019. Patient can file a complaint as a consumer. Now let's talk about the main 4D of medical negligence. Those D's are duty, dereliction, and damage and direct causation. So the duty, as I said earlier, the doctor must have had a legal and professional duty care towards the patient, and this duty arises when a doctor patient relationship is established, means the doctor accept the patient. Example, if a doctor agrees to treat a patient, they are as I said, expected to provide care with reasonable competence. Dereliction, the doctor failed to meet the standard of care expected of a reasonably competent medical profession. If refers to negligence, carelessness or deviation from expected medical practice. Example, failing to diagnose a condition when symptoms clearly point out. This is the example of dereliction. And what was the example of duty? If a doctor agrees to treat the patient, they are expected to provide care and reasonable competence. Now the damage. Example of damage is wrong drug leads to kidney failure. This is cause damage to the patient. The patient must have suffered actual harm, physical, mental or financial, due to the breach. No lawsuit can succeed without showing that patient was injured as a result. And the direct causation, there must be a direct cause and effect link between the doctor and negligence and the patient's injury. The harm must be specifically due to the dereliction, not other unrelated factor. A surgical sponge left inside leads to infection. This is the direct link. So this is the example of direct causation. So these are the main 4 T's of medical negligence: duty, dereliction, damage and direct cause. So please share and subscribe.